All right, welcome back. If you went with us into the break, for those that are just joining us, welcome on board. We are glad you have chosen Morning at NTV. We are taking note of solar energy implementation in improving health services across the country. Before I introduce my guests, let me just give you a preamble about what is on the ground. In response to emerging needs and dynamics in the health sector, access to reliable healthcare and electricity has undergone multiple transformations in the last decade, especially in remote and rural areas. Good health and clean energy, according to data that have been given, are two of the 17 United Nations Sustainable Development Goals, originally designed to be a shared blueprint for peace and prosperity for people and the planet, and now into the future. Unfortunately, rather little is known about the interaction between healthcare access and energy access in developing and underdeveloped countries, mainly in the rural or remote areas. In Uganda, Environmental Alert says it's embarking on a campaign to improve quality of health services through solar energy. And this morning, we are joined by Carolyne Nakajubi, a program manager at Environment Alert, as well as Peninah Atwiine, ENR Senior Program Officer at the same organization. Ladies, welcome to the program.
Thank you.
Who is Peninah and who is Carolyne?
Carolyne here. Nakajubi, I work with Environmental Alert, like said, as the program manager.
Okay.
Happy to be here.
Well, thank you for joining us. And
yeah, Peninah Atwiine, my name. I work as Senior Programs Officer at Environmental Alert, specifically in environment and natural resources. I'm happy to be here to share with you.
Okay, thank you very much. First and foremost, what is the thrust of the campaign by Environmental Alert, and what informs the nature and tone of the efforts that you'll be undertaking?
Okay, thank you. Environmental Alert, first and foremost, this very year we celebrated a whopping 35 years in existence.
35 years.
Yes, and just like the name sounds, we are out there to make sure that at least people benefit from the natural resources. So we are for natural resource management. We look at things to do with climate change. We get into renewable energy, wetlands restoration. So really we want to see, we envision communities that are resilient to climate change impacts and any other shocks they are in. So that is exactly what we promote. So anything that can help environmental management or climate action and all that related is something that we go for.
Okay. Yes. And what is the nexus with healthcare and the need to transition from existing technologies to sustainable energy?
For decades, we've come to realize that our health centers, mostly in the hard-to-reach areas and local areas, are facing with the challenges of energy. And if you can take some statistics, you realize that 80% of the Ugandans access health services from the government-led hospitals.
That's right.
And of which the 20% goes to private sector. So we realize that it's very important to invest more within the government health services or health centers to ensure that service delivery is improved. How do we do this? You also realize that those health centers, much as take the biggest percentage of patients or of service delivery, they're not well equipped with all the required facilities and equipments, especially energy. So you realize that only 37 to 38% of the health centers have access to electricity or solar systems. So us as Environmental Alert, through our partners, we realize that by powering such health centers, we would be improving the quality of health services given onto the communities. As Carolyne mentioned, we intend to make sure that our communities are empowered, have improved livelihoods, and of course to achieve all that, they must be having a good health. So renewable energy or solar energy is one of the sources or one of the ways we think we could improve service delivery and the quality of life for rural communities.
Okay, that is no doubt a very positive development. They need to be able to make healthcare more accessible and readily accessible. But in a country that is still heavily dependent on hydro and grid power, I do not know whether Environmental Alert is alive rather to the challenges that already exist within the available infrastructure when it comes to power and electricity rollout. I've been to places in this country where solar energy is being rolled out, and you could see many panels on the roofs of small houses, and then when you reach the health center you don't see a panel or two. That means, of course, but again there are complaints about the fact that solar energy is not as efficient, or in the layman's language, powerful enough. When you look at the health sector, it uses power intensive machines. I do not know whether that has been addressed. If it has, can you please take us through what Environmental Alert has? Carol, if you don't mind.
Okay, thank you. Quite a lump sum.
Yeah.
Yes, we are very cognizant of all the myths. Some have been myths, and some have been miscommunication of exactly about solar, and I wouldn't blame. Because first and foremost, I want to speak to the very many diverse fake products that are on market. And the inability to know where to go to. There is lack of information. I know that recently there were some solar standards that were developed by the ministry, but little is known about this actually. So we had to take in quite a lot of efforts to identify very good service providers, and honestly for us we just had to look for an external company that's not even Ugandan. But the thing of the capacity is to exactly know what capacity has been installed and what is it able to handle. Yeah. So the installation of these solar systems, for example, in places, we've worked in refugee settlements. I'll talk about Kasonga Health Center, that is Changwari, and then hard to reach areas because they're the ones that framed the problem of why we actually went into it. These are very remote places. So if you only just install a solar system and you're not telling people what capacities it is supposed to handle, then you're good as nothing. It's good as nothing because it will either fail or it will not be, you know, maintained. Because even if it is repairs and maintenance, people need to have the information and the data to know what exactly are they going to maintain, how are they going to do it. But of course also the funding, the finances that are supposed to support that. So that is how I can speak to that. That yes, there are so many, the opportunities are there, and we are also promoting renewable access to renewable energy and adoption, but we also must put in place, you know, an enabling environment. Both we, the ones that are doing it, supporters like us, but then also a government that has the mandate. Okay,
that's a huge responsibility on your part to put the government on the spot. The government is already mandated by nature of the fact that it's rolling out these activities, but it is a way of twitching here and there and reminding them, rather generally being a thorn in their leg. Yeah. How is the shared blueprint being rolled out? Is there even a shared blueprint between Environmental Alert and sector players working with government?
Yeah, for all the 35 years I think we have been working, we've managed to bring government together, to work together with civil societies and other players like private sector. And it is still our mandate as civil society to ensure that the government brings all stakeholders together into a multi-stakeholder planning platform to ensure that as government is planning, private sector knows what is happening, civil society knows what is happening, to ensure that there is a common understanding between the between all players. And in doing this, we have networks that brings together especially civil society organizations and private sector. They're all hosted at Environmental Alert, and we ensure that at every moment we get a chance or a space, we provide reporting to the government. We go to the communities, identify those gaps that exist, and of course the credits where a need be, and then we present them to government, and we say, look here, there is this and this and this, and we suggest that if we do this, this could be well. And as Karen mentioned, on the standards that have been produced, we've been actively participating in those government initiatives to ensure that we are all at the same page. But we also continue to raise awareness where need be to our communities and other players on the importance of renewable energy. Of course, much as we say renewable energy should be promoted, or much as we say that the government must take its part, it cannot do its part when communities are not aware or when we are seated. So we do awareness raising, and we provide support whenever we have resources to do that. Yeah.
Okay, maybe to
just add on
slide.
that.
Yes, thank you so much. In addition to that, Environmental Alert is an NGO.
You did.
It's an NGO.
It's an NGO.
Yes, and we can only do as much, really. That's why some of these are just really pilots to test and see, can this work?
That's right.
Actually, our motto is the evidence-based advocacy, is that we want to first try out things before we actually promote you know,
them
to the government. Sincerely, for example, in the refugee settlement, we've been able to only work in four health centers, yeah, one in the refugee settlement and another in the hard-to-reach areas, and some other things that we've been able to do regarding health in the other health centers. It is just minimal. When you look at Changwari Refugee Center, it itself has over 10 health centers, and we've only been in one. So it is for that reason that we realized, given the investment that is needed, private sector engagement or involvement in this is what is going to be very key, because government has better negotiation powers. Yeah, the bargain is better. So if private sector is structurally involved in this, then you're sure that you can actually have that scalability. For example, there are so many examples where you have see private sector coming up and putting maybe some of these systems or off-the-grid power solutions at health centers or institutions, and they're actually able to now sell to even the communities around. So if it has a business, you know, an income generating aspect in it,
that's an imperative.
To go and a bigger way to
it's an imperative that
scalability.
speaks to the business dividend into, you know, such incursions for a corporate entity or a business or a company for that matter. What do you use as the bait for companies and organizations to invest beyond what is normally described as corporate social responsibility, which in effect is actually not something that is does a lot of work? It's about being seen to be doing something, which actually is not very effective. How do you get them to get involved beyond CSR and public relations?
That's a very good question, but I think government should be able to answer to that more. But number one, the best that we can do, number one, is to put up best practices, bring communities, bring private sector together. So dialogue has been very key through these multi-stakeholder approaches, through our contribution to policies. We've done a lot of contributing to policies and through the networks that we host. And there are always those consultations that are done. But basically, if you're able to document and sell a best practice to government, to private sector, then you're able to bring them on board. But I would still want to refer that back to government to really do that engagement.
Okay, we seem to be working within a whole set of challenges to these initiatives, because we're already facing problems with existing infrastructure, especially regarding power. Maintenance of these machines and equipment is already a problem. The other day we had at Mulago Hospital over 20 machines were sitting idle. Now, the capacity to maintain machines that use hydro or the normal grid power is already a problem. What is the capacity of these centers, especially in the rural areas, to maintain those ones that are using another form of energy, especially for solar?
Okay. That is a biggest challenge actually in the energy sector that we've been facing since the inception of our interventions in the health center. So maintenance and operation it's not only for on-grid power, but also off-grid. And renewable energy for it is actually worse. It is a new technology that has come into the country or into the continent. We don't even have capacity, a lot of counterfeit in the market, no regulation to stop such counterfeits. And of course, even our institutions of learnings, the few that are teaching it or that are taking it up as a subject or a course, it is still minimal. And we faced challenges. Last year we are engaging with the Ministry of Health, and they were informed that at least 1,000 health centers have received solar panels. But of those, 90–80% of them who received solar panels are not working. And you can imagine, they're not working. It might not even be a big problem, a big challenge with the system, but just like a clean or a disconnect or a replacement of a battery or lighting, something like that, which has not been done. So I would say to end this, government need to come up, because for us as civil society or as non-state actors can't do much, but government has to put strategies, place strategies on how to equip our communities, or especially the youth, on maintenance and operation. What strategies are there? Like, for example, Carol was mentioning the project we have implemented in the Kasonga Health Center. There is a good system there at the building, at the maternity ward, but it's not functioning. Why? Because they don't have capacity to maintain it. And much as we don't have the maintenance and operational capacity, but still I do put it on a financial aspect. I would request the government possibly to commit some fee to the district levels quarterly to ensure that the installed system, either by private sector or by government, are maintained.
The government you are asking has already told you that there is a funding squeeze across the globe. Donors are holding back. Governments and other financial institutions can no longer roll out grants or give money as quickly as they ought to. Environmental Alert must be working under the aegis of funders. What is the current state of affairs when it comes to funding?
Of course, there is a clear budget cut with the donor community. You've been even seeing some of the biggest donors being rolled out. They cannot fund any projects in Uganda. But still, I still insist it is a matter of priority. We pay taxes, and that money is there. They can say we can prioritize this, and if that is prioritized, money is there to handle this. So I would say it's we need to prioritize our interventions, what is more important, especially for health. And we all know that a healthy community is a healthy economy. So to have an economy that is very productive, we must use the little resources that is available for us to ensure that we reach at a certain level.
Okay.
Let me add something.
Please do.
Yes. What Environmental Alert has specifically tried to do was to respond to the challenge we are talking about. Number one has been the capacity building of the health officials that are actually the custodians of these systems, but then also the other local communities, you know, village health teams, the support structures within the communities. And we also wanted to put an income generating aspect to it, because if someone has been trained and taken through how to maintain a solar system at a health center, because we made them practical, then they are also able to probably do the same in communities and be able to get some money, because people have these solar panels, small solar panels at household level. So that is what was also that's what was beneficial. But then also we went ahead to speak to districts, local government. Yes, we have installed, and these are programs or rather even projects. It will end, yeah? But the issue of ownership for all partners that are working in some of these areas is very key, because we have made some researches and assessments here, and some of these solar panels that are actually broken down, partners have come, or government installed them, left them there. No capacity enhancement of how to maintain. There is no structure of how these monies will actually find themselves into the maintenance of these solar systems. But I want to credit the districts we've worked with, the 4 districts, that's Kasese, Chegegwa, Chikume and Chibale. They have, through the MOUs.
This whole initiative is in one part of the country.
Yes.
Yes.
Why?
Because of the COVID-19 and its impact. We majorly looked at refugee centers. Yeah, it is the Albertine. Yes, we majorly looked at we majorly looked at the COVID-19 impacts and the way people were suffering majorly in the refugee settlements.
The people in that
and
part of the country were affected more than the rest.
Yes.
Ah, that's interesting. It's new research, and it's a new lead for the guys in the newsroom to go and find out why people in a certain part of the country were affected more than the others.
It's
but anyway,
because of refugee and hard to reach.
Okay, refugee and hard to reach. All right, so that
yes, so that I was saying that through the memorandum of understandings, the districts have committed to actually incorporate this in their quarterly budgets to do the maintenance, and for us that's sustainability enough.
Okay, looking at having a bird's eye view of this intervention with already existing interventions from the government, I want to dwell now on the connection to climate change and mitigation. Why? Most of the health centers that are in hard-to-reach areas, these hard-to-reach areas are already grappling with the effects of climate change, including inaccessibility due to rivers flooding, mountains suffering mudslides. Is there a project within the existing framework that looks at mobile public health care facilities, ones that can be able to attend to communities like the ones affected by climate change and its adverse effects, using renewable energy? For example, a truck mobile clinic. Are these ones rolling out? Anybody can answer that?
By environmental art? No.
No.
No, but what
You're
we
still
have
waiting
done...
for money?
Yes, but at least, you see, have you heard of a tricycle, or have you seen one?
I've seen one.
Yeah, an ambulance tricycle. Yes.
An ambulance tricycle
yes.
cannot, for example, make its way in Butaleja and Mount Elgon Ranges.
Can I attempt to answer?
Okay.
Like, for example, environmental art through this project, we have used the government structures at local levels to ensure that services reach to the common person deep in the hard-to-reach area or in the refugee area before he accesses even the health center. To do this, we all know that government has put a strategy to use the voluntary health teams, the VHTs. So we've managed to work with VHTs, empower them, give them refresher courses, provide them with available training manuals and awareness raising support to ensure that when they go to the field, they have what to use. They know, they actually even have what to tell the communities out there. And what the tricycle Carol was saying, we gave out that tricycle. If he reached there and found that there is a critical illness within the community, he's able to call at the health center, please, there is a condition here, please, can we help? Yeah, we think with that it is a drop in the water.
It's really better than nothing. A place like Chivale, with those very hard to reach roads, that's stony and all that, a tricycle is very important.
All right, Carolyne Nakajubi, Program Manager at Environmental Alert, and Peninah Atwiine, ENR Senior Program Officer, still at Environmental Alert. Many thanks for the perspective and taking us through the initiatives as being rolled out by your organization in ensuring that there is a nexus between renewable energy and the health sector in the country. That will do it for Tech Note, but do stay with us. The conversation in our Kickstarter that was supposed to come before the Tech Note is related. So Priscilla, Regina and Aloga shall be at hand to take us through that. Do stay with us. We'll be right back.